Have you ever experienced your finger getting stuck like this? In the morning, or when you're doing something, it could be your index finger, your middle finger, your ring finger, or your little finger, sometimes your thumb as well. Or sometimes you feel a click, like click, and then you put it open and you unclick it. Okay, so that's not normal. Some people think it's aging, but I can't blame aging as well. Just want you to know that it's not normal. That's called trigger finger, and if you ignore it, it stops moving altogether and gets really stiff. Okay, here's the problem with trigger finger, right? You see, trigger fingers, it was called trigger finger because back in the days, a lot of soldiers had it because they keep on using their guns, their rifle, and because they keep on pulling trigger, eventually they end up having this lock syndrome in their finger, and that's why the doctors then, this trivia news, the doctors then call it as trigger finger, right? So trigger finger happens when the tendon sheath around your tendon in your finger gets swollen, gets inflamed, gets thickened, right? And then what happens that your tendon cannot slide very smoothly anymore. So what happens that your tendon in your finger actually clicks or locks and cannot straighten without you forcing it open with the other hand. Of course, there are some people who are more prone to having trigger fingers, such as if you are suffering from diabetes, or if you do lots of repetitive gripping and your hobbies or at work, or you play a lot of sports like pickleball or golf, where you hold the bat or you hold the club quite strong, which is obviously loser lah. Okay, I'm going to bust the myth for you right now on trigger finger. Most people wait. They just say, wait and see. Only trigger finger, only a little bit pain, only a bit stiff. They wait on trigger finger because trigger finger doesn't feel so painful at the start. They can bear the pain and it's not so bad, right? As a head occupational therapist, I think it's a big mistake lah. It's not that big yet, but it's a medium level mistake. It's not something that you should ignore, because the longer you leave your trigger finger be, the stiffer it gets over time. What starts as a clay, what starts as a soreness in your hand, in your finger, can become a permanently bent finger that may need surgery to fix. I know it doesn't sound nice, but I like to present you with the facts and the data first, and then you decide, you think about it, right? And so many people think that, I should just do this, and then it will heal itself. No. It worse, some people buy the stress ball and they squeeze it, say, I got to exercise it more, and then you get better. No. Stretching it by yourself or doing gripping will only make it worse. It irritates and you get more stiff. So the solution that normally I recommend for patients, right, is a Phoenix hand therapist will assess whether you need splinting, and it's called anti-trigger splinting, specific stretching exercises or specific exercises for your trigger finger. Or we can even refer you to a hand doctor or an orthopedic surgeon for an injection. But we try to we attempt to prevent you from seeing a doctor, from having to need to see a doctor in the first place, right? Or need surgery in the first place. So in Phoenix REHAB, this is exactly what our hand therapy team handles every day. It's our bread and butter conditions that we treat. We'll tell you honestly where you stand and what you actually need. Or you already had a trigger finger surgery, and right now you need to make sure that it doesn't stiffen up. We also treat post trigger finger release surgery hand therapy as well. So if your finger has been clicking, your finger has been swelling or locking, or you just had trigger finger release surgery, please don't wait until it's stiffer or stuck. Just WhatsApp us or just reach out to us through the comment channel, and then we will get you seen as soon as you can. That's all I have for you today. Take care and don't let your fingers stay click and lock. Okay, bye.